Good morning, everyone. Welcome to today's town hall. I'm Jennifer Schultz, Senior Vice President of Marketing and Communications. We really appreciate you joining us this morning and watching today. We are very excited. It's going to be a great day. Over the years, OU Health Sciences Center and OU Medicine have been known by many names. When we reached out to the public to ask about how they interacted with our organization and to better learn their perceptions of us, we learned that it was unclear to them exactly who we were. The myriad of names further contributed to challenges in clearly articulating who we are and how we are the partner for all Oklahomans in achieving better health for all. We also found that many of the more than 12,000 people working across our organizations were also uncertain about our identity. It was time to fix it. So now, with that little hint, I'm going to invite Chuck Spicer and Dr. Jason Sanders to tell us about the solution. Chuck Spicer is President and CEO of OU Medicine, and Dr. Sanders is Provost and Senior Vice President of OU Health Sciences Center.
Always fun to choreograph these things in a socially distant manner and to make sure I stay scripted. Jennifer has typed up comments for me so I don't miss the message. But thank you, Jennifer. We are the flagship comprehensive academic health system for the state of Oklahoma. We have been steadfast in that commitment to deliver not just great patient care, but education and research with our great faculty colleagues. Over the last 100 years, we've had a lot of names, more than we can even count. We've taken care of so many families, delivered more babies than could fit in this room. We've been a part of scientific breakthroughs and new educational programs. We've won awards and we've celebrated milestones. But we're not done.
Good morning. Over the past few years, we've been striving for more. OU Medicine became an Oklahoma nonprofit and started a new journey of changing health for all Oklahomans. OU Medicine and the OU Health Sciences Center are steadfast partners, inextricably linked to one another. As a combined effort, we're transforming as an enterprise every aspect of what we do. And what we do is centered on the people we serve and serve with. This includes modern technology, new state-of-the-art facilities, and research breakthroughs that we use in each patient's care plan.
These unbelievable transformations and accomplishments lead us to today's announcement. But before we get into the meat of the announcement, we have a special video to show.
We're more than 100 years in the making, and as a team, we're still breaking new ground. Over the years, we've celebrated more, educated more, contributed more, healed more. And because of our combined effort, our entire team is still striving for more. As a local Oklahoma nonprofit, we're writing our own history as Oklahoma's only comprehensive academic health system, with everything from children's specialty care to the highest level of cancer care to routine and complex care. Modern technology, new state-of-the-art facilities, research breakthroughs that we use in care plans are all available for every Oklahoman. We're a team of 12,000, and we continue to revolutionize the state of health. As a team, we understand that people don't live for their blood pressure scores. They live for the joy in their lives. That's why when people come to us for care, we understand that we are a part of the journey that gives them more memories. That's why to us, health is not just a word, it's a state of mind. Health is a life well lived. It's time with those you love, doing the things you love. We are a part of bringing life to everyday moments because we believe our patients' best days are ahead. Health is renewal, care that is not just doctor and medicine focused, but centered around our patients and their story. It's about transforming the way we heal our patients at every stage of life. Health is collaborative. Delivering innovative and compassionate care takes a team effort. Through the combined efforts of OU Medicine and the OU Health Sciences Center, we combine the best in clinical care, research, and education to bring the future of health to Oklahoma. leading the charge. We are the front lines of scientific breakthroughs and treatments, not just for complex procedures, but for routine wellness checks. We don't accept boundaries. We push beyond perceived limitations. Our momentum is building, and it's time for a new name to reflect our limitless future. Our future is health, and the future of health is here. OU Health.
So I think that deserves. So it's a pleasure to share with you today our new combined story, our new combined brand, OU Health. We're going to be talking, Chuck and myself, a little bit more about that and what makes us unique. And we're really pleased to introduce after that several speakers who are going to share the story of what OU Health means. As we look across the country, academic medicine, academic healthcare in the United States, there are very few institutions who look like us. The comprehensiveness of OU Medicine and the OU Health Sciences Center is truly rare. We have education for all health professions with 7 colleges and a school of community medicine spanning the state from Oklahoma City to Tulsa. We have a freestanding children's hospital, a flagship academic medical center, a community hospital, faculty practices across the Health Sciences Center, including the largest physicians group practice in Oklahoma City and Tulsa. You know we have a National Cancer Institute, an aging center, a diabetes center. All of these healthcare resources, capabilities, the people who make them successful here in Oklahoma, with close proximity to each other for care coordination. This is truly unique, not just in Oklahoma, but across the country. Campuses with education of all health profession disciplines are rare, with the OU Health Sciences Center being among only 6 in the country with this comprehensiveness. You know that freestanding children's hospitals are unique in the services that they offer for children, with specialties which are essential and found nowhere close by: anesthesiology, surgery, pediatric medical specialties. This proximity, the proximity and integration of the education, are programs for students, for residents. You simply can't find that, not only here in Oklahoma, you can't find that in every state in the country. You add to that the group of NCI-designated cancer centers, the gold standard for when you or a loved one faces the diagnosis of cancer, only 72 in the country. You combine that with a flagship academic medical center, which has some of the most specialized services, again, not only in Oklahoma, but in our region, a diabetes center, faculty practices across our institution. You have incredible breadth and depth of academic healthcare capabilities that are rare and not seen elsewhere. You combine all of this with a healthcare research engine. The OU Health Sciences Center research is more than triple the size of any other healthcare research center in Oklahoma. It has grown just in the past year over 30%. Another sign of the momentum overall that we have in OU Health. We needed a name that covered the comprehensiveness of this steadfast partnership between OU Medicine and the OU Health Science Center, a partnership that spans what is so unique about what you do every day, what we do every day. The intersection of research and discovery, education, and clinical care is found at OU Health, and we are all a part of OU Health. What we're sharing today is a name we're all a part of that you can take great pride in, that shows how unique what you've achieved has done and sets us on a direction for the future. As you know, we're a large team. We continue to grow. As we make this announcement today, it's another milestone on our journey. And I look around the auditorium here, and for those joining us virtually online, and see many leaders, the people every day across our organization who have made us successful and will carry us to the future. It's an affirmation that we're all a part of OU Health, and it takes all of us to succeed. In particular, I want to highlight the 8 deans from the colleges we have on the OU Health Center who are joining us today, either in person, either socially distanced and with masks here in the auditorium, or virtually. From the OU College of Medicine, Dr. John Zubialdi. Dr. Zubialdi is also the president of OU Health Physicians in Oklahoma City. From the Fran and Earl Ziegler College of Nursing, Dr. Julie Hoff. From the OU College of Pharmacy, Dr. Jolene Dragalis. From the OU College of Dentistry, Dr. Raymond Colmia. From the OU Hudson College of Public Health, Dr. Gary Raskob. From the OU College of Allied Health, Dr. Alan Knehans. From the OU Health Sciences Center Graduate College, Dr. Ann Pereira. From the OU School of Community Medicine, their research, from the laboratory bench to the bedside to the community, and with their faculty practices, the people who see the patients we serve every day, they are all part of OU Health. They're part of our future.
You know, Jason didn't realize how hot it was going to be in here, so I'm going to take off that. Couldn't have a little bit of drama, right? People were worried what I was going to take off. So the comprehensiveness of OU Health is tremendous, and it's one of the things that draws patients and providers and professionals to us. We are OU Health. We also are Stevenson Cancer Center, the only place in Oklahoma where you can get NCI level care and access to the most clinical trials leading the country. And we're proud to have Dr. Robert Mantle, the director of the Stevenson Cancer Center, with us virtually today. Harold Ham Diabetes Center, another key crown jewel in our crown, is committed to curing diabetes and ending the diabetes epidemic in the 21st century. Dr. Jed Friedman leads that initiative and effort with Harold Ham Diabetes Center, and we thank him and welcome him. OU Health is now home to the Oklahoma Children's Hospital. Not the Children's Hospital, but Oklahoma's Children's Hospital. The state's only level 4 neonatal ICU, this level 4, the state's only freestanding children's hospital, the cardiac programs, the cancer programs, all the specialty programs that we deliver, and we thank John Hayes for his leadership, and he joins us today virtually. OU Health is now also home to the University of Oklahoma Medical Center, the state's only level 1 trauma center, complementing the work that Stevenson does to provide complex cancer care. And we're also excited to have Chris Ghost here with us today to celebrate that. And Lisa Wilson, leader of the University, or now OU Medical Center, OU Health Edmond Medical Center, the cornerstone of the Edmond community for 70 plus years. Thank you for your leadership. OU Health is also OU Health Physicians, the state's most highly skilled and specialized multi-specialty group practice in the state. Ann Barnes, the Chief Administrative Officer of OU Health Physicians, is here, and Jonathan Joyner, the Chief Operating Officer of OU Health Physicians in Tulsa, also representing us. As we continue to grow clinical care of seniors and research on aging, Dr. William Sontag, Director of the Reynolds, Oklahoma Center on Aging, is sharing our announcement today. A lot of different people make up the greatness and the breadth of OU Health. Many departments and services, too many that we can name, the physicians and researchers and faculty under the leadership of both Dr. Sanders and Dr. Zubialdi, the team of professionals and nurses and other staff I get to lead as a part of OU Medicine, make up our combined effort. Our combined effort is here to improve the lives of people. We share that mission, and we share it to benefit the people we serve. We've simplified the name, so now Oklahomans can count on that combined effort to continue to provide care for us. As a reflection on the last 12 years that we've had OU Medicine being the glue for the enterprise, I reflect on the fact that we've had that medicine, and now it's time to enjoy health and move on to truly being that combined effort that strives to improve the lives of all people. We're so excited about this, and it's a time in the pandemic that we need that jolt of pride to demonstrate what you all have done every day for the last 6.5 months, to stare COVID in the face and be committed to defeating it and bringing health to people. Thank you, and I'll turn it back to Jennifer.
Excellent. Thank you, Chuck. I do want to give another special shout out. OU Health Physicians in Tulsa has been a great demonstration of our collaboration across multiple cities, and Dr. Peter Aaron actually joined us in person today. He is the Chief Medical Officer of OU Health Physicians in Tulsa. I know Dr. Herman wasn't able to join us, and so thank you so much, Dr. Aaron, for being here. So we are actually going to have a really special treat today. We've done a lot of town halls through COVID where we've talked a lot about updates. We've talked a lot about logistics and operations, research advances. We've had Dr. Sanders and Chuck giving us a lot of situation information. And today is a day to celebrate. And so we're really going to talk about what health means to us. And we have some special speakers here today that are going to share in that conversation and their perspective. So I'm going to first hand it over to Dr. Rachel Franklin. Dr. Franklin is the medical director of OU Health Physicians Family Medicine Clinic. She's going to give us an overview of what OU Health means to her and to her patients.
Thank you, Jennifer. I've been a student, a resident physician, and a faculty member here at OU Health. I left private practice many years ago to return home to join the wonderful things that we do here at OU. I'm also a patient. My children were born here, and my entire family chooses OU Health for their health care. As a primary care physician, I'm often the first contact and the continuous advocate for my patient in their health journey as they see our entire healthcare team, from physician services to physical therapy, from the advice and prescriptions offered by our pharmacists to the care provided by our great nursing staff. And while all of these services individually assist our patients through their healthcare journey, they still don't represent all that health encompasses. We teach that health is not the absence of disease. It's not the cure of disease. Health is a state of mind. It's a future full of hope. It's time with those that you love, doing the things that bring meaning to your life. For our patients to experience health, they need more than just a good diagnosis and treatment plan. They need a multidisciplinary team that understands their dreams and goals and works to help them overcome any barrier to their well-being. Our behavioral health specialists, care managers, social workers, and others are important members of our care teams who partner with patients as they seek to achieve this broader definition of health. At OU Health, we understand that people don't live for their blood pressure scores, as you saw in the video. They live for the joy in their lives. They really do. That's why when people come to us for care, we understand that we're part of that journey that gives them hope of creating more memories. Good health means time for making memories. And time is the most valued gift of all. Health is connection to each other, to our community, and to our patients. It is connection to our future selves and what is possible when we take care of each other. Health is healing. At OU Health, connection and healing is important to us. All of the research, all the education, and all the care we provide leads to those connections and healing, Jennifer.
Thank you, Dr. Franklin. I am excited to present our next speaker, Dr. Valerie Williams, who will address how health translates to academics and the academic aspect of what we do on our campuses. Dr. Williams is Vice Provost for Academic Affairs and Faculty Development at the University of Oklahoma Health Sciences Center. In this role, she has responsibility for campus-wide academic affairs, academic integrity, and faculty development.
Thank you, Jennifer. You know, on the University of Oklahoma Health Sciences Center campus, our faculty and staff have been given the awesome, honorable, and humbling responsibility of educating tomorrow's healthcare providers, researchers, and scholars. Sometimes those responsibilities focus on medicine, but at all times they are focused on health. I am so honored to work with these colleagues and to work for an organization that regards every person as valuable and finds inclusive ways to train tomorrow's healthcare leaders. We see our identities as important here. We see color, ethnicity, gender, and the abilities of people, including those with short-term or long-term disabilities, as significant to our personal stories. And we appreciate those unique life experiences. They contribute in remarkable ways to our strengths. When people come together and apply their talents in service to others, that is a remarkable asset of great benefit to our students and to their future patients' lives. When we embrace all of our differences, we help our students find and use their voices and their talents for greatest impact. We believe in teamwork. We believe in shared learning. We believe in a community of practice and finding your voice both locally and nationally. Our faculty handbook at the Health Sciences Center actually says that the definition of teaching is the transmission of knowledge and cultural values aimed at and focusing on helping students to learn. As we work to broaden the minds and futures of our students, we encourage the synthesis of our new ideas, produced and published data, technology transfer, our successes with patent awards, and in the new applications of information technologies to improve education and to improve healthcare. This synthesis is really at the root of health, and it's our future. It is so rewarding for me to see our organizations come together under an umbrella that truly identifies the actions and thoughts and feelings of the people who invest a large chunk of their lives in our campuses. And it identifies the core value that makes us want to come to work every single day. So thank you all for being my colleagues in this work. This is an amazing day, and I'm so excited about it. Jennifer, I'll turn it back over to you.
Great. Thank you, Dr. Williams. OU Health is also research, and next I'd like to introduce Dr. David Sparling, a researcher and pediatric clinician with OU Health Harold Hamm Diabetes Center. Dr. Sparling has both an MD and a PhD from OU Health Sciences Center. He did his clinical training at Columbia University in New York City and came back to us as a faculty member. Having both an MD and PhD allows him to integrate his research and clinical practice, bringing patients the most current diabetic clinical care. Dr. Sparling?
Thank you. It's a pleasure to be here today. So one of the things that I think makes this organization truly stand out and unlike any other in Oklahoma is the scope of the research that's conducted here, including all of the clinical trials we offer, how healthcare research really applies immediately to the care we provide our patients, giving them science-based best practices when receiving care here, which is really the gold standard in all of healthcare. To me, OU Health really does speak to this. It illustrates that using broad science across healthcare, we can lead our lives very well. Research leads directly to health, and every day, research breakthroughs are being used in our patient care plans. I've had the pleasure of being both a researcher and a clinician. I've seen diabetes care change rather dramatically since beginning my practice. Diabetes patients used to have to carry around enough material to fit in a briefcase all of their supplies and all of their insulin. And today, you can have discrete, pager-sized, for those of us who remember what pagers are, insulin pumps that deliver their medication. This is really significant for the children that I take care of because they don't want to be characterized or burdened by their disease. So the Harold Ham Diabetes Center seeks to be a world leader in inspiring innovative, creative diabetes research focused on progress towards a cure, along with the education of our healthcare professionals and our families that are dealing with diabetes, along with the optimal care for people with diabetes and effective strategies for prevention. So whether it's carrying out clinical trials for new drugs, identifying best practices for diabetes care and identification in our patients, or working on the frontiers of new breakthroughs, what really distinguishes the physicians that make up our group beyond their dedication to our patients is our quest for new knowledge. We're privileged to have an extraordinary combination of basic researchers and clinician scientists who are advancing the science of diabetes and diabetes care. And the combination of talent and technology across the organization, especially at the HHDC, is really on display every day. Now, one of the things that I really think is special that occurs on this campus is also the collaboration between various centers for research excellence. So, for example, the Stevenson Cancer Research Center, the Harold Ham Diabetes Center, and the Aging and Geroscience Center are really engaged in connections between diabetes, obesity, aging, and cancer. We know that these processes are linked, and our researchers really are looking to unlock new answers that will positively impact and improve our lives. So health really is at the root of everything that we do here. It's medicine, it's research, it's our families and our lives, and it's really why we get out of the bed every morning and come into work. So thank you.
Dr. Sparling. As we all know, nursing is a major part of what we do through OU Health. We have great nursing leadership in Kathy Pierce, the Chief Nursing Executive for OU Medicine Hospitals, and Dean Julie Hoff, the Dean of the College of Nursing. Not only do we have nearly 3,000 nurses in clinics and hospitals, but there's also nurse educators and future nurses across the campus and at the Fran and Earl Ziegler College of Nursing. Our final guest today is Dr. Amy Kostner-Lark, who is a family nurse practitioner at OU Health Physicians and an assistant professor of nursing at the OU College of Nursing.
Thank you. It is my distinct pleasure to be here today on behalf of nurses across the OU Health system. I would like to speak to the collaborative impact of nursing and OU Health in the state of Oklahoma. As a professor at the Fran and Earl Ziegler College of Nursing, I am charged with the education of future nurses and advanced practice nurses. As an advanced practice nurse, I am fortunate to practice primary care at OU Health Systems in the Department of Geriatrics. My career, like many of my other nursing colleagues, is a good example of the multifaceted nature of nursing. Nurse researchers on this campus advance discovery through innovations and advance nursing science that translates into improved health outcomes for patients. Nurses advocate for health promotion, educate patients and the public on the prevention of illness. Nurses are on the cutting edge of health policy and help shape local, state, and national laws. You will always find nurses at the bedside participating in rehabilitation and providing expert, compassionate care and comfort to patients and their families. Advanced practice nurses are highly trained medical professionals who collaborate with their physician colleagues to provide evidence-based care across the healthcare continuum. No other healthcare profession has such a broad and far-reaching role as nursing. It is no surprise that nursing is consistently voted the most trusted profession. OU Health. What does that mean through the lens of a nurse? Health is more than the absence of disease. You stole my line. And together with all the members of the interprofessional healthcare team, we are here to promote wellness and health so that Oklahomans live a richer and longer life. Nursing is health, and we are OU Nursing. I am honored to represent OU nurses across the hospitals, clinics, academic and research setting in today's announcement. Thank you.
Thank you to all of our speakers today. As the video said, our work has been building and our momentum is rising. We're feeling the transformation, and it's time for a new name to reflect our limitless future. We know this future is one that encompasses the story of our patients, our stories, and our lives together. To support our unified vision of serving the health needs of all Oklahomans, we've rolled out a transformative new digital front door, ouhealth.com. You may have woken up to that today. You'll be able to see on the large screen that this website was created with patients and public in mind. It offers a wealth of healthcare content, easy navigation to healthcare services, our doctors, and the locations in which you can receive care. OU Health is a fresh new face for our comprehensive healthcare system. Our web presence reflects the energy and forward-thinking direction of who we are as OU Health. It's bright, it's an intuitive website, a regenesis of work that is ever evolving, growing, and is a key component in our commitment to do more for our patients. I always call a website the first front door. It's the digital front door. Most consumers enter into it to find what they need or want. Like a welcoming and hospitable home, that front door must be easy to find and have a warm and inviting appearance. Because quality healthcare heavily influences quality of life, we want to eliminate every obstacle to access. Our purpose is to meet the patient where need and access intersect. Our unique services, expertise, and emerging technologies exist for the benefit of patients. We strive to present robust content that is practical and informative and in demand and constantly evolving. We know that we have a lot of forward-moving work on our new website, but it's here. The new site represents more than 100 specialties, over 1,000 providers. As part of our mission and vision, leading healthcare to improve the lives of all people, it is our duty to make sure that we have these resources readily available to the public. We want them to be able to find how they can get care with us. OU Health is where knowledge, stories, and insights that live within our organization will be shared in meaningful ways with our patients through new publishing platforms and strategies aligned for constant access. We know that you will have a lot of questions. So while we have leaders in the room, we want to take some time if there are questions that you have. Many of you will submit questions for town halls into the Pulse at oumedicine.com. We encourage you to do that now because we want to make sure we're answering those questions. But while we wait for that to come in, I do want to share just a bit of information with you. All of your leaders have toolkits with some different facts and information about OU Health, and they're going to be sharing that with you today. We're going to make those resources available to you as well. We know that we'll have ongoing questions and things about implementation of our brand. But also following this town hall, we'll be sending out a special issue of the Pulse. It's going to have some more specific information as we move through the transition, but also some exciting activities planned in the next couple of weeks. Beginning tomorrow, we'll be holding what we're calling celebration stations. They'll be at various locations across our enterprise, including several on this campus, in Edmond, and in Tulsa, along with deliveries to satellite clinics. When you stop by and show your name badge, you'll receive a special OU Health branded gift. Very much COVID protocols in mind, so that's where we have celebration stations, the drive-through, pick up, all of that. A couple of other key things I just want to make note of as we wait to see if we're going to get some questions. You heard earlier, OU Health is the combined effort of OU Health Sciences Center and OU Medicine. OU Health is a name change and a brand redesign to better communicate who we are as a combined health system. It's not the creation of a new organization. It's our unified, collaborative, combined effort. That means that wherever you are employed, whether by the University of Oklahoma Health Sciences Center or OU Medicine, Inc., your employment, your benefits, your leadership team, support services, policies, procedures, and workflow are not changing as a result of this rebrand. A unified brand is another major step in becoming we. We'll see the OU Health brand roll out gradually and in phases with patient-facing functions addressed first. Immediate changes include the launch of the new website, along with a comprehensive statewide marketing and communications campaign. That means that you do not need to focus on changing anything immediately. Your leadership teams will work with you and with your employees, keeping everyone informed as things are changing. Work groups have been formed across the enterprise and have started working on planning and coordinating the transition of future phases of the OU Health brand rollout over the coming months. It includes things like looking at campus signage, phone scripts, email, promotional items, and much more. When ready, all of those updates will come from the work groups, from your leaders, or they'll come out through the Leader Newswire and the Pulse. Later phases of the brand implementation will include us evaluating and extending additional OU Health brands. This is an exciting time, and we invite you to visit things like our online store, where you can check out OU Health branded merchandise available for purchase. It's optional and can be purchased at your own discretion. So we have a couple of quick questions. How do I use the new name of OU Health? Names will be updated to reflect the OU Health brand for the hospitals, centers of excellence, faculty practices, for the health professions colleges, and the statewide physicians practice. This is going to take us some time. With those work groups, just to give you an example, you'll see some of this in our communications. We'll make sure that we know that things like OU Medical Center will now be called OU Health University of Oklahoma Medical Center. Or something like OU Dentistry Faculty Practice will now be called OU Health Dentistry. Many, many examples of this that we'll be able to share. Another question, if a friend or neighbor asks you, who do you work for? We suggest some sort of response adapted to reflect your role within the healthcare system and how unified we are. You could say something like, I'm a part of OU Health. I work in human resources for the OU Health Sciences Center. Or I'm a part of OU Health, and I'm a nurse at OU Health Edmond Medical Center. We are all a part of OU Health. OU Health brings together and incorporates the expertise of the 7 professional colleges at the University of Oklahoma Health Sciences Center. We are going to be actually going into a phase of work with our academic leaders around how we can tie in and show the collaboration of colleges in OU Health, so that's going to be another project we'll be looking at. We're working with the marketing and communications team on the Norman campus with that project as well, so we're very excited about it. I am not seeing any other questions coming in, so I want to just take a moment and pause. We'll just do a quick double check. All right. So we said earlier that there's not anything we need to do today except for celebrate, and so enjoy the day. We'll be sharing more information today and as we move forward. And I'm going to actually hand it back over to Dr. Sanders and Chuck for final closing words.
Thank you again for your time. I think disappointed there's not questions, but there will be some, and they can relay them to us, and we'll answer them. Thank you for our colleagues that have joined us and taken the time to celebrate this day. This is a beginning, and this is a commitment, and I think that's what we got to keep in mind, that the statement we're making now to the people that we serve is about creating health for their life. And I love the blood pressure score comment, because they're really not interested in that. They're interested in the score of the baseball game they'll coach when they get out of the hospital. It's about the life we put and the health we create, much more than the medicine we've provided inside the hospital. And I think that statement is finally bold and in bold print for the people that count on us to know. So thank you. Thank you, Jason, for your partnership.
Thank you, Chuck. I'd like to reiterate the question Jennifer said. As you go home this evening or as you talk at lunchtime coming up, where do you work? What do you do? To now be able to start and say, I'm a part of OU Health. It's something that we all share in common. It's something that we've known we've shared, but we've struggled to tell that story across the state and even nationally. And that's so much of the work that went into this, the stories you heard today. It's something we're all a part of. As Chuck said, it's another milestone on becoming we. It's a milestone on all of our capabilities that are unique coming together as an academic health system. So we hope that you have great pride as you share what you're a part of. And we hope through the website, we hope through the stories that you tell, as OU Health shows our combined efforts. We hope that people see what you see every day. We hope that more people will say, wow, that's amazing. I didn't realize that. I didn't realize this. I'd love to come get care at OU Health. I'd love to join OU Health and be part of your team. Huge appreciation to Jennifer and her team for all the work that's gone into this. Please look at the messages you'll see by email. And Besides appreciation, I will underscore what Jennifer said. We want to make today a day to celebrate. Chuck shared how it's been a long spring, a long summer with COVID. We have months ahead. It's a marathon. Today, we want you to celebrate, and we hope you do so. Thank you.